acne is something that just about everyone has endured, and many even into adulthood. Even after those breakouts begin to fade, the signs of acne can stick around for a lifetime. For years, those scars were something that people just had to live with, but not anymore. The beauty coach, Dr. Anne-Therese Stubbs of Anne-Therese Aesthetic Medicine, is here with a brand new product that is creating amazing results. I can't wait to hear about this, so welcome, Dr. Anne.
Thanks for having me.
So this is called Bellafill.
Yes.
Tell us what this is.
Bellafill is a new filler. It's been on the market for a few years, but it recently has had its approval for acne scars. You know, the pitting scars that are left over after the active acne has come through. So it's kind of a permanent, it has a semi-permanent basis to it, so that maybe people won't have to get this filled over and over again.
That's perfect for a lot of folks. And what types of acne scars does this work on? Because we know there's a few.
We're seeing a couple different pictures here, and basically there's a couple different shapes of scars. But what I tell my patients is that if you can take your fingers and kind of spread that scar out and distend it, and it smooths, those are the kind of scars that respond to Bellafill, to respond to us filling with this little filler that kind of plumps them out and smooths the skin.
So how does Bellafill work?
It's two things that are involved in this filler. One is a polymethyl methacrylate. It's a big long word, PMMA, and that's kind of a matrix that forms your own collagen around it. And so it's almost just like a little basket weave on a microscopic level. And then there's some bovine collagen. Collagen's long been used to kind of plump the face in different ways, shapes, forms, and collagen's been around for years. Bovine collagen is derived from cows, so we do need to do a little bit of a skin test on people before they have it. We just put a little bit right on the forearm, watch it for a week or two. If there's no reaction at all, then they're great candidates for this filler. And
you mentioned semi-permanent. How long does it last?
Well, the studies are out to 3 years, and people have not had the need for any refill. Also, this can be used in the fold area, the nasolabial folds area, for up to 2 years of correction.
And is this different than other dermal fillers? Because we've heard of, collagen and things you mentioned before.
Right, this is different in that it does have that little matrix that could be, the studies are still going. It might be kind of a semi-permanent filler. Usually the hyaluronic acids like Restylane, Perlane, Juvederm, those go away in about 6 to 9 months. Sometimes the Sculptor can last up to 2 years. Voluma has an approval for up to 2 years. And this looks like it's going to have just a little bit of an edge on that. And for acne scarring, that's something that's remarkable, because people don't want those marks back.
No.
Some of the other folds in our face we might be okay with. Okay, that's a natural look for me as I age, but acne scars are never a natural look for anybody.
And when will people see results? They last a long time, but will they see them right away?
They will see them right away, because that bovine collagen plumps right out and gives them the smoothness right away. And then, so that eventually fades over the next 3 months, and that's when that little matrix of that, PMMA just starts building your own collagen. So this is kind of some results as the time goes. You can kind of see the difference. They're circled, the scars. You can see some mild improvement in the second picture, and then even better in the third.
And that just looks so impressive over time. I mean, I'm sure you would get used to that, and you'd want to keep that forever.
Exactly, because people who have these types of scars have been used to covering them with makeup. Some have even tried to tan them, which is a horrible way to damage the collagen even further. But folks who suffer from this, they just really want these scars smoothed out, because it's kind of a reminder of their days of acne. And even though the active acne isn't present, they still have the pit marks to remind them of that.
And Dr. Anne, you always have a great incentive. You have a special deal on Bellafill right now for people to come in.
We do. We have 20% off. Our consultations are always complimentary, because people don't always know whether they're a candidate or not. So we'll do a complimentary consultation and do the skin test if they're interested, and then 20% off each syringe.
Okay, thank you so much, Dr. Anne. Phone number and website are on screen, so hopefully people see you and results very soon.
Great. Thanks so much.